Good morning, everybody. Today we will talk about several topics. First, it will be non-inflammatory disease of cervix and vulva, algorithm of examination, management, and treatment. The diseases of cervix and vulva include the cervical ectropion, the cervical polyp, cervical intraepithelian neoplasia, precancer, genital warts, leukoplakia of cervix and vulva, Neoplasia cysts, and cervical fibroids. Cervical ectropion is a condition in which the cells of the inside of the cervical canal, known as glandular cells or columnar epithelium, are present on the outside of the vaginal portion of the cervix. The cells of the on the outside of the cervix are typically squamous epithelial cells. This is no therapy needed if PAP-test is good, without inflammation and cell atypia. These pictures shows the cervical ectropion. All of these ectropions are normal. Cervical polyp. Cervical polyp is a common benign polyp or tumor on the surface of the cervical canal. They can cause irregular menstrual bleeding, but often show no symptoms. Treatment consists on removal of the polyp by forceps, lip excision, or hysteroscopy, and prognosis is generally good. Cervical intraepithelial neoplasia. Cervical intraepithelial neoplasia, also known as cervical dysplasia, is abnormal growth of the cell on the surface of the cervix that could potentially lead to cervical cancer. More specifically, SIN refers to the potentially precancerous transformation of the cells of the cervix. Here you can see cervical intraepithelial neoplasia, first grade, and this is cervical neoepithelial neoplasia, second up to second grade. So genital warts caused by human papillomavirus. In this slide, I try to show you condylomas of the cervix. And this is also cervix with condyloma. This is vulval condylomatosis. This is also vulval condylomatosis. Leukoplakia of the cervix and vulva. Leukoplakia is a firmly attached patch on a mucous membrane, which is associated with increased risk of cancer. The age of the lesion are typically abrupt, and the lesion changed with time. Treatment recommendations depends on the feature of the lesion. If abnormal cells are present or the lesion is small, surgical removal is often recommended. Here you can see cervical leukoplakia. This is vulval leukoplakia or chlorosis. Neoplasia cyst is a mucus-filled cyst or follicle on the surface of the cervix. They are most often caused when stratified squamous epithelium of the cervix portion nearest to the vagina grows over the simple columnar epithelium of the endocervix portion nearest to the uterus. These tissue growths can block the cervical crypts, subdermal pockets, usually from 2 up to 10 millimeters in diameter, trapping cervical mucus inside the crypts. Neoplasia cysts usually require no treatment and frequently resolve on their own. Cervical fibroids are large fibroids on the anterior lip and Neoplasia follicle on the posterior lip. Here you can see anterior lip, this is posterior lip. They are probably happened from trauma at childbirth. There is no treatment required if there is no symptoms, dyspareunia, pain during intercourse, cervical abundant discharge, and PAP-test with inflammation. If a woman has the symptoms above mentioned, there is suggested surgical treatment. Electroexcision with radio knife is preferred. PAP-test, the diagnostic of cervical disease include PAP-test, vaginal swab on genital infections, as they are called laboratory tests. Also instrumental examination, colposcopy, cervicoscopy, hysteroscopy, one of the part of the hysteroscopy, and ultrasound examination. PAP-test. The Papa-Nicolau test, abbreviated as PAP-test, also known as pap smear, cervical smear, is also known as pap smear, cervical screening, or smear test, is a method of cervical screening used to detect potentially precancerous and cancerous processes in the cervix. Vaginal swab on genital infections. Smear of the flora is one of the important diagnostic methods that allow obtaining a biomaterial for microscopic laboratory testing from the surface of the skin and mucous membranes. Most often, this concept refers to the taking of material from the surface of the vaginal mucosa and or cervical canal. Polymerase chain reaction on genital infection, human papillomavirus, for example, in the case of cervical disease and concurrent infections such as chlamydia trachomatis, mycoplasma genitalium. Colposcopy is a medical diagnostic procedure to visually examine the cervix as well as the vagina and vulva using a colposcope. The main goal of colposcopy is to prevent cervical cancer by detecting and treating precancerous lesions early. Cervicoscopy is one of the parts of hysteroscopy, the endovendoscopic examination. The main purpose is to examine the structure and or lesion of cervical canal. Also can be used to remove the cervical polyps by using loop resection. Ultrasound examination of the cervix. The main purpose is to evaluate the structure of the mucus and the cervix, the length and state of the cervical canal to determine the benign tumors, cervical fibroids, polyps, and hyperplasia of the endocervix. Here you can see the length of the cervix in pregnancy. This is head of the fetus. Here you can see cervical myoma. This is uterus. This is cervix. In this slide, in this picture, you can see cervical polyp inside of the cervical canal. And this is also polyp. This is cervical canal. This is cervix. Pathological conditions and precancerous disease of the endometrium. Etiology, pathogenesis, clinical signs, differential diagnosis, and management. Pathological conditions and precancerous disease of the endometrium include endometrial hyperplasia, which divided to simple, complex, and atypical, or precancer, and endometrial polyps, which is divided to glandular fibrous, and adenomatous precancer. Endometrial hyperplasia is a condition of excessive proliferation of the cells of the endometrium or inner lining of the uterus. Most cases of endometrial hyperplasia result from the levels of estrogens combined with insufficient levels of progesterone, like hormones, which ordinarily counteract estrogen's proliferative effect on this tissue. It may occur in a number of settings, including obesity, polycystic ovary syndrome, estrogen-producing tumors, and certain formulations of estrogen replacement therapy. Endometrial hyperplasia is a significant risk factor for the development or even coexistence of cancer. In this picture, you can see simple endometrial hyperplasia. In this picture, you also can see simple endometrial hyperplasia. This woman is bleeding for 1 month, so you can see the color of the endometrium is yellow, like endometrial hyperplasia. Atypical endometrial hyperplasia, also divided to simple or complex. Simple or complex architectural changes with worrisome atypical changes in gland cells, including the cell stratification, tufting, loss of nuclear polarity, large nuclear, and increase on mitotic activity. These changes are similar to those seen in true cancer cells, but atypical hyperplasia does not show invasion into the connective tissues, the defining characteristic of cancer. In this video, I try to show you the atypical local hyperplasia. You can see the structure. And this is a loop of the hysteroscopy. Treatment of endometrial hyperplasia is individualized and may include conservative, hormonal therapy, progestin therapy, dufaston, norcolud, or intrauterine device Mirena, surgical, hysteroscopy, endometrial ablation in the case of simple endometrial hyperplasia, and hysterectomy in the case of complex recurrent endometrial hyperplasia and atypical endometrial hyperplasia. In this video, I wanted to show you the endometrial ablation by using this ball monopolar electrode by hysteroscopy. You can see the electrocoagulation and destruction of the surface of the endometrium, which is hyperplasia with hyperplasia. Endometrial polyp is a benign nodular protrusion of the endometrial surface. Symptoms: most of endometrial polyps have no symptoms. Some of women have metrorrhagia, blood spotting between menstrual periods, infertility, because these polyps play a role like a intrauterine device, which is not allowed to implant fertilized ovum into the endometrium. Diagnostics includes ultrasonography. Differential diagnostics is cervical polyp, uterine fibroids, submucosal myoma, endometrial hyperplasia, endometrial cancer. Endometrial polyp, in this picture you can see on the anterior wall of the cavity of the uterus and the posterior wall of the cavity of the uterus, glandular polyps. They look like follicles, you can see here. They are also round. All of them are benign. And we are using monopolar loop to make an excision by hysteroscopy. Endometrial cancer. You can see these lesions are without bones, boulders, abnormal form, like cabbage, and with a typical vessels. Here you can see typical vessels. Differential diagnosis is submucosal myoma. Submucosal myoma is the benign tumor of the myometrium, not endometrium. How to find out that it is myoma? The structure, as you can see here, is firm and white, a little bit yellow. It is quite more firmer than polyps and white color. Infertility. Infertility is an inability to become pregnant after 1 year of intercourse without contraception. It divides into primary and secondary. Primary infertility is an inability of the woman to conceive from the very beginning of the reproductive period. Secondary infertility is an inability to conceive or carry a baby to full term after having a previous successful pregnancy. Factors of infertility include hormonal chronic anovulation caused by polycystic ovary syndrome and or hypoandrogenism, tubal peritoneal factor caused by adhesive disease after genital infection, inflammatory disease, surgical treatment, the anomalies of genital tract, aplasia of uterus, total obliteration of cervical canal, chromosomal anomalies, gonadal dysgenesis, endometriosis of ovaries and or uterus. It is insufficient work of the ovaries with endometrioid cyst, the insufficient structure of endometrioid myometrium in the case of uterus endometriosis, and adhesive disease caused by endometrioid heterotopias. Submucosal myoma, endometrial polyps, and hyperplasia, the inability of cavity of the uterus and or the insufficiency of the endometrial mucosa to accept the fertilized ovum. Man's factor, infertile sperm, and idiopathic infertility. The algorithm of survey of a married couple for male is spermogram and determination of anti-sperm antibodies. For female and male, the determination of genital infections, polymerase chain test, immunoenzyme analysis. Female, the analysis of menstrual function, regular or irregular. Female sonography on 6 up to 8 day of the last menstrual period, the determination of the ovarian reserve, the exclusion of anomalies of genital organs, exclusion of endometrial pathology, polyps, submucosal myomas, hyperplasia, which can damage the fertilized ovum for implantation. The sonography on 11th up to 14th day of the last menstrual period. It is the time scale of probable ovulation is needed to detect the dominant follicle, the follicle which is having a mature ovum, oocyte. Female, the measurement of basal body temperature in ovulation, the temperature increase on at least 0.2 up to 0.4 of Fahrenheit in BBT. Monitoring BBTs is one of the way to estimate the day of ovulation. The tendency of a woman to have a lower temperature before ovulation and the higher temperatures afterwards is known as biphasic temperature pattern. Checking the patency of fallopian tubes using hysteroscopy is a radiologic procedure to investigate the shape of the uterine cavity and the shape of the patency of the fallopian tubes. This means it is special X-ray using dialogue at the uterus by fallopian tubes. It injects a radio-opaque material into the cervical canal and usually fluoroscopy with image intensification. A normal result shows that the filling of the uterine cavity and bilateral filling of the fallopian tube with the injection material to demonstrate tubal rupture. Spillage the material into the peritoneal cavity needs to be observed. It has a vital role in treatment of infertility, especially in case of fallopian tube blockade. Hysterosonography is ultrasound examination which allows to access the test patency of the fallopian tubes and the state of the uterine cavity by insertion of physiological solution through cervical canal by special uterine cannula. In this picture, you can see hydrosonography, ultrasonography. This is uterus. This is a liquid solution, physiological solution, and tubes. Both of these tubes are patent. This is a hysterosalpingography. You can see normal fallopian tubes, which is not blocked. You can see here the material which we insert into through the cervical canal. In this picture, you can see double uterus. Here you can see one cervix and two cavities of the uterus. The abnormal forms, not like triangle like here, abnormal forms. This tube, right fallopian tube, is normal, and left fallopian tube is blocked. These both fallopian tubes are blocked. You can't see anything here without any material. Treatment of infertile women include hormonal factor, chronic anovulation caused by polycystic ovary syndrome and or hyperandrogenism is used for regulation menstrual function. For example, oral contraceptives or progesterone. If oral contraception is used, it should be not more than 6 months is prescribed. Then the oral contraceptives is suggested to change on progesterone. Oral contraceptive is used daily in one time, 21 pill plus 7 break day, or 28 pill without timeout. Progesterone is used from 16th up to 25th day of the last menstrual period. Every time of the 26th day of LMP, a woman have to test pregnancy by urinary or blood test on chronic human gonadotropin concentration. If she is pregnant, progesterone shouldn't be stopped. She have to continue to use it to prolong pregnancy during 12 up to 20 weeks of pregnancy and more. If pregnancy doesn't happen, a patient cancel progesterone, and during 1 up to 5 days of canceling progesterone, the menstruation will start. Then again, begin using progesterone from the 16th up to 25th day of LMP. Progesterone is performed in two widespread forms. Dufaston, 10 milligrams for 2 times per 24 hours, and Ultragestan. Dufaston is dydrogesterone, and Ultragestan is natural progesterone, which is used on concentration 200 milligrams 1 time per 24 hours, or maybe 100 milligrams 2 times per 24 hours. A woman can use it orally or vaginally. Dufaston can be used only by oral. The treatment in tubal peritoneal factor, which caused by adhesive disease after genital infection, inflammatory disease. Surgical treatment includes anti-inflammative, antibacterial, and anti-adhesive medication, and laparoscopic surgery, which consists from salpingo variolysis. It is adhesions around It is when adhesions around the oviduct and ovary are resected. Their anatomical location is restored. The adhesions in the lumen of the fallopian tubes are separated. Fimbriolysis and fimbrioplasty. Fimbria of the final section of the pipe, which are adjacent to the ovary, are released from adhesions, and inflammatory transudate is removed from the pipe. If necessary, fimbrioplastics is performed. Salpingostomy and salpingoneostomy, and they form a new opening of the ampullary section of the oviduct, or are released from adhesions of the anatomical opening minus salpingoneostomy. A new opening is very quickly overgrown, unfortunately. Tubectomy, removal of a pipe tubes performed on women over 35 years old, or if it is possible to restore the patency of the impossible of the oviduct and eliminate hydrosalpinx. In the case of anomalies of genital tract, anaplasia of the uterus, total obliteration of cervical canal, chromosomal anomalies, gonadal dysgenesis, it is the absence of ovaries. It is suggested only one way is surrogate mother. Men's factor, infertile sperm, the family should have a consultation and treatment of urologist and andrologist. And idiopathic infertility is infertility which we don't know why it happens. We suggest such couples to attend to in vitro fertilization. Endometriosis or of ovaries and uterus, the insufficient work of the ovaries with endometrioid cyst, the insufficient structure of endometrioid myometrium, adhesive disease caused by endometrioid heterotopias, submucosal myoma, it is inability of cavity of the uterus, endometrial polyp and hyperplasia is an insufficiency of endometrial mucosa to accept fertile ovum. It is treated by surgery, laparoscopy generally suggested, or laparotomy in the case of endometrioid cysts of the ovary. Hysteroscopy, myoma resection, polypectomy, and curettage. In the case of submucosal myoma is myoma resection, endometrial polypectomia, hyperplasia is curettage. The endometriosis of the uterus in infertile woman is treated by using hormonal medication. Gestagen dinegestin pills or gestagen levonorgestrel in intravenous device. Endometriosis can be treated by hormonal medications in ongoing usage. Only in the case of recurrent endometriosis after surgical treatment, or in the case of small endometrioid cysts less than 25 millimeters in diameter. IVF fertilization is a process of fertilization where an egg is combined with sperm outside of the body in vitro, in glass, and the process involves monitoring and stimulating a woman's ovulatory, removing an ovum or ova from the woman's ovaries and letting sperm fertilize them in the culture medium in laboratory. After fertilized, zygote undergoes embryo culture for 2 up to 6 days. It is implanted in the same another woman's uterus with the intention of establishing a successful pregnancy. IVF is a type of assisted reproductive technology used for infertility treatment and gestational surrogacy. A fertilized egg may be implanted into surrogate uterus, and the resulting child is genetically unrelated to this woman. The indications to IVF is tubal factor of infertility, male's factor of infertility, genetic factor when the carrier is of defective genes responsible for fertilization, surrogate mother with fertilized ovum from biological parents, and the woman who has passed IVF has got cryo embryos, frozen embryo before oncological treatment, surgical removal of ovaries, radiotherapy, and chemotherapy. We will continue our lecture. Next topic is contraception. Contraceptive methods in females include rhythm method or calendar method, withdrawal method, when the coitus is without ejaculation inside of the vagina, mechanic contraceptives, chemical contraceptives, and hormonal contraceptives. Rhythm methods, also called calendar method, safe period method, and natural method. Depends on time of ovulation. Dangerous period is from 12th up to 15th day when ovulation is probably occur. In the case of normal, 28 up to 30-day menstrual period. Ovum is viable for 48 up to 72 hours. The sperm remain alive during 24 up to 48 hours. In some rare cases, it is described in the literature the 8-day surviving of the sperm. Probably safety period of intercourse is on 4th up to 8th day and or after 18th up to 20th day of the last menstrual period. Mechanic contraceptives include condom, vaginal diaphragm, intrauterine device with a copper, silver, or gold component. This is vaginal diaphragms, condom, and vagina and intrauterine device, different shapes and forms, and metal component. Chemical contraceptives means spermicides, chemical substance which is inserted to vagina immediately after intercourse in form suppository, gel, or creams. The substance damage the sperm because substance is mostly acid. Sperm is light alkalic. The effectiveness of these methods is from 75 up to 90%. It is quite low effectiveness. Hormonal contraception. Hormonal contraception consists of estrogen and or gestagen, or progestin and or progesterone are synonyms component. When taken orally, hormone level rises through 1 hour. Negative feedback effect act on anterior pituitary, inhibit gonadotropins, FSH and LH, and inhibit ovulation. Types of hormonal contraceptives there are 3 types. First type is combined contraceptive, estrogen plus gestagen in pills or vaginal ring or patch. Single component contraceptive, only gestagen component in pills or subdermal stick, implant, or intrauterine device is allowed while breastfeeding. Also allowed in the case of contraindications or in using combined contraceptives. Postcoital contraceptive means high dose of gestagen, levonorgestrel 150 milligrams totally. It can be divided into 2 doses with 75 milligrams 2 times per 12 hours, or mifepristone 10 milligrams 1 time. Is using in the first 72 hours after intercourse. It is suggested to be used during 24 hours after intercourse, because the effect is higher at on 98.5% if it is used during 24 hours after intercourse, more likely than later. Combined contraceptions. Contraceptives consist estrogen and gestagen together in pills, vaginal ring, or PAP patch. They can be monophase, two-phase, or three-phase. More often is used monophase because it is comfortable to use. If you forgot to swallow the tablet, you can swallow it during 12 hours after you remember. Here is the most widespread forms. It goes, trade name is Jas or Jasmine. This is Nuva ring. This is vaginal ring, which is inserted inside of the vagina during 3 weeks. Then it is getting out. You should get out, and the menstruation or bleeding will happen during 7-day off period. In the case of Jasmine, the woman have to drink 21 tablets, then 7 days of day off. In this day off period, bleeding will happen. In the case of Jas, a woman should swallow 28 tablets without day off. There are 24 tablets with hormones, and 4 tablets are placebo, and the menstrual reaction will happen in placebo. Plus, the patch ERA is transdermal or hormonal contraception, which is using on the derma, on the skin, on the skin of the leg, hip, and the abdomen or back. There are 3 patches in one pack, and every patch is for 1 week, and the woman should change it 1 patch per 1 week. So it means 3 weeks is using of ERA, and then 1 week of day off, when bleeding will happen in this day off period. Single component contraceptives. There consist only gestagen component in pills or subdermal stick implant or intrauterine device. Is allowed while breastfeeding, also allowed in the case of contraindications in using combined contraceptives. Implanon is using subdermal by special application. It is very easy to insert to this place on the hand. Or, for example, trade name is Cervicoscopy. It contains desogestrel, it's gestagen. There are 28 pills. Women should swallow 1 pill, should take 1 pill per 1 day, every 24 hours, pills, without any day off. If she will take 28 tablets, then the next pack will be on the 29th day, and so on. Mirena is intrauterine device. In this place, it contains gestagen called levonorgestrel. It protects uterus from the proliferative diseases, for example, hyperplasia of endometrium, myoma, and also it protects from pregnancy because it inhibits ovulation and also mechanic mechanism also is using, because the device is inside of the uterus and protect the cavity from the implantation of fertilized ovum. Mirena is using to up to 5 years. Then the woman should have a rest for 1 up to several months after getting out it, and then insert new Mirena, and so on. Postcoital contraceptive consists a high dose of gestagen, levonorgestrel 150 totally, or mifepristone 10 milligrams, is using in the first 72 hours after intercourse. As a reminder, it is suggested to be used during 24 hours after intercourse, because the effect will be quite more higher than if you will use it after more than 24 hours later after intercourse. These are widespread in Kyrgyzstan, in Russia. Trade name is Escapel, levonorgestrel. 1 tablet contains 150 micrograms totally. Postinor have 75 micrograms and it divided into 2 tablets, which should be taken during 12 hours, not more than 12 hours each tablet. And mifepristone. Mifepristone is mostly suggested if a woman, if there is more than 24 hours passed after intercourse, but less than 72 hours. It will protect from pregnancy. Medical treatment by using hormonal contraceptives, combined contraceptive. Indications: menstrual irregularity, hormonal disorders, for example, hyperandrogenism or syndrome, polycystic ovaries, the tendency of formation functional ovarian cysts, and algodysmenorrhea, which is painful menstruation. Medical treatment by using hormonal contraceptives, single components include endometriosis, uterus and ovaries. Again, I mentioned that uterus means adenomyosis, and the ovaries means ovarian cyst less than 25 millimeters, myoma, recurrent endometrial hyperplasia, even atypical hyperplasia also can be treated by using intrauterine device, Mirena. If a combined hormonal contraceptive is not allowed in the case of breastfeeding, the conditions of hypercoagulability, the thrombosis in the past, migraines, hypertensive disorder, varicose disease of 2 or 3 stage. Varicose disease of first stage is not contraindicated to using combined contraceptive. Side effects of hormonal contraceptions include amenorrhea, irregularity of bleeding, depression, nausea, migraines, decreased libido, weight gain, edema, and mastodynia, pain in the breast. If these side effects are not disappear after 2 blisters of using contraceptive 2 periods, it is suggested to change hormonal contraception on other component, also hormonal. Complications of hormonal contraception include ovarian suppression syndrome. It occurs after hormonal contraceptives are cancelled, when ovaries can't get started to work, can't awake. Exacerbation of gastrointestinal disease, etc., cholelithiasis, for example, the pain in the legs or thrombophlebitis, and thrombosis. Contraceptions for adolescents. World Health Organization consider that adolescents are the young people from 10 up to 19 years old. The early beginning of sexual life prescribe the early using of contraceptive methods. The most effective contraceptive method is a hormonal method. It is 99.7% of effectiveness. The rules of clinic recommendations of hormonal contraceptives prescriptions in adolescents include microdose of combined hormonal contraceptive are most recommended when the level of antinyl estradiol should be not more than 20 micrograms. Gestagen component on combined hormonal contraceptive should be from the last generation. It means that desogestrel, Gestoden, Norestimate, Dienogest, and drospirenone. Low dose combined hormonal contraceptives, if the level is of estrogen is not more than 25 up to 30 micrograms. Single component hormonal contraceptive is not recommended because frequent case of irregular hemorrhage happen. Medium dose hormonal contraceptive level more than 30 micrograms is not allowed. Is not suggested, is not allowed because they can cause premature closure of the growth centers of the bone epiphysis. Medical abortion. Medical abortion in the first trimester of the pregnancy include using mifepristone and misoprostol. Mifepristone is analog of progestin. Norethistrone acts as an antagonist, blocking the effect of natural progesterone. Additions of low-dose prostaglandins, 800 milligrams, improves the efficiency of the first trimester abortion. It is effective up to 63 days and highly successful when it is used within 49 days of gestation. Methotrexate and misoprostol in the dosage 50 milligrams per meter squared before 56 days of gestation, followed by 7 days later. Misoprostol 800 milligrams vaginally is highly effective. Misoprostol may have to be repeated after 24 hours if it is failed. Methotrexate and misoprostol is less expensive, but takes longer time than mifepristone and misoprostol. Methotrexate and misoprostol is not recommended in lots of countries because of the low effectiveness. The effectiveness of this method is not more than 80% in front of mifepristone and misoprostol. The complications of medical abortion include incomplete abortion. It means when the products of conception are inside of the uterus and there is bleeding and the external os is open, but products of conception cannot be getting out without curettage or vacuum aspiration is needed in this case. The hemorrhage also one of the cause of incomplete abortion, or may be caused by insufficiency or some disturbances in coagulogramma. The prolongation of the pregnancy also can be after using mifepristone and misoprostol, and the prolongation of the pregnancy is strictly recommended to make a curettage or vacuum extraction or other surgical treatment, because the fetus or embryos will be with defects, because mifepristone is very embryotoxic and teratogenic. And the ascending infection, in the case of incomplete abortion, if there is more than 1 week after abortion happened, there is high risk of ascending infection.